Thank you. Let me shift to the discussion that we had when I was in your office back in November, and that was about healthcare provider shortage. So I'll give you an example in the congressional district that I serve. We have a county, it's called Henderson County, where the patient-to-physician ratio is 6,995 patients to one physician. That contrasts, like if you look at Cook County, in our largest county in Illinois, we're Chicago area, the ratio there is 1,200 to 1. So, and then you've also have these example. We have a hospital that literally took 7 years to recruit a physician. So, and we talked a little bit about this before, but. We worked together, my colleagues and I, in last year's funding bill to direct the Health Resources Services Administration to provide a report to our committee within 120 days of how recruitment could be better handled to address these provider shortages. I did note that in the President's budget, his proposal is to cut the healthcare workforce program by $824 million, or about 50%. And so I was just wondering how your department will square that massive cut with ending provider shortages, or at least addressing provider shortages, especially in rural America.
Yeah, so I understand your concern and your question. The program that we fund there is the National Health Service Corps, which really lets us, through tuition reimbursement, get people who nurses, doctors, dentists through a reimbursement system to serve in rural communities and underserved areas. The other program, the one you mentioned that we propose cutting, it doesn't have demonstrable results in terms of producing that kind of service in rural and underserved areas. It more goes to institutions as subsidies around teaching. The other thing that we want to do is reform our graduate medical education program. That's why we advocate combining the Medicare, Medicaid, and children's graduate medical education programs and getting rid of the caps that we had from the 1990s that freeze in place specialties, so that we can enhance our primary care doctors that we produce and psychs and other underserved specialty areas to get them into rural areas. That's part of the plan also.
Okay, I have like several follow-up questions. I can get those to you later because I'm out of time right now. But thank you for being here, and thanks for your answers.